The actual process of getting on a waiting list is fairly complicated. First, you have to have a referral from a nephrologist. It can actually come from any physician, but typically a nephrologist. Once we go through the information, we bring the patient in for evaluation. They go through a battery of tests, lab tests, x-rays, heart testing or cardiac testing, and a number of other testing.
As a pre-kidney coordinator, we help our patients through the evaluation process and to help to determine if they're an appropriate candidate for transplant. The evaluation process entails medical testing, appointments and interviews with other staff, and meeting with the doctors. And then once they get through the evaluation phase, if they are an appropriate candidate and they qualify for transplant, then we can present them at a list at our patient selection committee.
And if a person then is deemed to be a viable candidate for transplant, then we put them on what's called the waiting list.
Once they're listed, we follow care with them up until the time they're transplanted. So we manage their listing at that time where if they're due for annual testing, we'll schedule their annual testing. We ask them to keep their health optimized, follow up with any healthcare providers for screenings or healthcare recommendations such as cardiology appointments, ophthalmology, or dermatology. And then we follow them up to the time where they are transplanted.
Once people are on a waiting list, we tell them to go on with life as they normally do. If you're on dialysis, you continue your dialysis. If you're not on dialysis, you continue seeing your nephrologist. People are sometimes working. You go to work every day. You just live life as you normally have lived it. And if and when an organ becomes available, then we call the patient and give them some information about the offer. Then we call them in for transplant.
We are their advocate for them getting a transplant. So from the time that we talk to them on the phone and get their health history up to the time they get that call for the transplant, we are cheering them on all the way.